I brought a few pages that the American people would be interested in. The stack closest to the podium is actually the House bill. It's the 2,000-page House bill. On this side is what we're working off of so far on the Senate side, because what's been put together has been put together behind closed doors and it hasn't been released yet. I assume that's because they don't know what the cost is and what adjustments will have to be made in order to meet the cost requirements, although it is an extension of costs of probably $1 trillion. And I wonder if there's anybody in America that believes that you can expand programs by $1 trillion and it won't cost a dime for the rest of us. But at any rate, the stacks over here are the ones from the Senate side, and the little bottom stack down there is the Senate Health, Education, Labor, and Pensions Committee bill, and then this is the Senate Finance bill. It's a 1,500-page bill, although when we were actually debating the bill in committee, we didn't know how big the bill would be, because we worked off a 220-page summary and did summary amendments. And so this is the first time that we've actually gotten to look at the final product. And the interesting thing about doing a summary bill is that the amendments are done summary, and if an amendment does happen to pass by the minority, then it's written by the majority. And the devil's always in the details. So we're very anxious to see, although there's not a lot of amendments that we got passed there. And what I mostly want to talk about today is the effect on small business. The status quo in healthcare is unacceptable. Healthcare costs are skyrocketing, insurance premiums are increasing, and too many small businesses can no longer afford to offer health insurance to their workers. While I agree that we need to change our current system, the approach reflected in the current health reform bills is the wrong answer. That's these bills. Quite a stack of paper, very encompassing, very comprehensive. This is going to affect every single American. We have never had a bill that affected every single American. And that's why it's so complicated, that's why it's so large, that's why it's so hard to deal with, and that's why there will be so many mistakes as we go through a pile like that trying to make a few amendments that will improve the bill. They need a lot of amendments that will improve the bill. But while I agree that we need to change our current system, the approach reflected in the current health reform bills is the wrong answer. I object to the current health reform bills, not because I support the status quo, but because the bills do nothing to address the problems of increasing costs and premiums. These bills will not reduce healthcare costs and will actually increase insurance premiums for most Americans. I've fought for years to enact common sense reforms that will help slow healthcare cost growth and make the insurance market work better, particularly for small businesses. Before I entered politics, my wife and I ran a small business. We had shoe stores. We know firsthand how hard it is to meet payroll and provide meaningful benefits to employees. I understand how the current insurance market fails to meet the needs of many small businesses. The 2,000-page Pelosi bill and the 1,500-page Senate Finance bill will drive up costs, increase taxes, and expand the size of government. The nonpartisan Congressional Budget Office, the administration's own official actuaries, and the National Association of State Insurance Commissioners, and at least 6 other private studies have all reported that the Democrat leadership bills will drive up costs. Even the Congressional Budget Office has said premiums in the new insurance exchanges would tend to be higher than the average premiums in the current law individual market. Let me say that again. That's the Congressional Budget Office said, quote, premiums in the new insurance exchanges will tend to be higher than the average premiums in the current law individual market. Now, when 85% of Americans who already have health insurance hear the term health care reform, they expect and want Washington to do something that lowers the cost of their health insurance premiums. Unfortunately, the bills that Congress has developed will do the exact opposite.